Back pain, part one, the problem. Back pain is a significant part of any civilized country, in any country in the world, their health budget. In the United States, according to Duke University study of 2004, it cost $26 billion. $26 billion just for back pain. The time loss was 818,000 life years, and this is a study by the CDC in 2005. Now, this problem is one that we had solved way back in the mid-'80s. And if you look at the graph, you'll see on the right-hand side the most highly trained, highly educated neurologist had less than 2% success rate non-surgically. The next one over is the chiropractor or osteopath who just does manipulation. And we're reading from right to left. The third person is an osteopath, also does regular manipulation. The fourth one is a general practitioner using whatever he can use. The next one over to the left is the orthopedist. And slightly above him is a chiropractor who does total treatment, whether it be physiotherapy or whatever, and nutrition. Presumably it's shotgun nutrition. Next to the chiropractor, we have the acupuncturist who had slightly better results because he is actually working with body circuits with some knowledge of what's happening to them. Next to that is the physiatrist using drugs. So even using drugs, they had a little better than a 30% success rate. Then they found the applied kinesiologist who had some understanding of testing muscles and testing the vertebra and the discs, and they had about a 50% success rate. Using our method, which we developed in the course of our studies, called the Vickery method of chiropractic and osteopathy, we had achieved nearly 100%. And the nearly 100% was because we had one case in process that we didn't bother to put in there, and that case was successful. So we had 50 successful cases of all kinds, easy ones, herniated discs, all kinds of visible to normal testing. We decided to go back to the prestigious colleges of medicine, which I had done some 10 years ago, and they basically said, well, it's an infection, it's this, it's that, it's strained, it's da da da. So we decided to go back and see what they're saying as of today. This will save you a trip to Google or Yahoo or whatever. Low back pain can range from mild, dull, annoying pain to persistent, severe, disabling pain in the lower back. Pain in the lower back can restrict mobility and interfere with normal functioning. Low back pain is one of the most significant health problems. At some time in their life, 85% of the people will have it, and people usually below 45 years old or younger. This is 75% is the National Institutes of Health. The World Organization of Health says 90%. So what do they say is the cause? What causes low back pain? Even with today's technology, the exact cause of low back pain can be found in very few cases. In most cases, back pain may be a symptom of many different causes, including any or several of the following: overuse, trauma, injury, fracture, degeneration of vertebra, infection, we'll come back to that in part 2, abnormal growth tumor, obesity, which changes the weight and distribution on the spinal disc, poor muscle tone, muscle tension or spasm, strain or sprain, ligament or muscle tears, joint problems, protruding herniated slip disc, which is obvious on the instruments, and disease, osteoarthritis, spondylosis, compression, fractures, etc. In 1985, had found that we had this tremendous success rate because we had two tests, the CCT test and the BEV test. And these are better than the standard medical procedures, which are X-ray, CAT scan, thermography occasionally, but usually it is magnetic resonance. So the view that you see when you get a magnetic resonance, saying you had a fifth lumbar disc lesion, it would be similar to the chart that's now on the screen. And that's what would show on the magnetic resonance or the CAT scan. Now, the next chart shows what we see using our BEV tests and or our CCT tests. It shows that a lot of these people, the entire spine is breaking down, and they're breaking down because of nutritional as well as mechanical and electrical problems. So that it remains invisible to the medical community and is rapidly and easily available to us. A person should stand with a straight posture, and that was our goal, to get these people back to the straight posture. What we saw when people came in was the crooked man that was laying on the screen now. Our goal was to straighten that out to get back to be the straight person. You could not do that unless you did a whole raft of things. We're greatly successful in this, and we presented this graph in 1987 to 500 chiropractors in a convention. Nobody was even curious about what we were talking about. They didn't believe it. I expect that you may not believe it either. But in part 2, we'll show you the solutions and how we have arrived at this. If you look at the medical treatment that is shown on both Stanford University and Yale University, they never once include nutrition in the treatment or the cause. We found that the nutrition was #1, and our mechanical correction was #2. Very often, if a person came in and had disc lesions, we would not even treat them. We would put them on the proper nutrients and have them come back a week later. A week later, they may have only a few discs that we had to correct manually, and the rest of them cleared up without our intervention. So when we finished, we had a straight patient who was pain-free and could work and prevent. We had the prevention also for the disc lesions. We sort of put back pain aside, but we noticed that our back pain sales are very low, and fibromyalgia, which is a much harder condition because even though it includes degenerative disc disease, it's a hard sell because fibromyalgia people are so beat up, they don't believe anything after a while. After being through 25 or 30 doctors, who'd believe anybody anyway? So the success that we had in practice, we're not seeing in our sales in back pain. And now that we have sort of got everything else in order, we're going back to back pain because it is not getting the proper attention that it deserves. And our back pain packages have every known nutrient that affects the spine. And we'll go into those in part 2 as to their effectiveness. Generally, if you take the back pain package and you do not receive 80% relief in 2 or 3 weeks, you probably have an infection. We'll also go into that in detail. Because it's not known medically, people don't relate also, as doctors of chiropractic don't relate to it. And they're supposed to be the ones that know these things. Nutrition is the first thing in healing the back. And we'll give you chapter and verse on that in part 2. But all this money, millions of hours of lost work time, expense, and $26 billion, we could make a tremendous dent in that and perhaps cut it in half if everybody had the tools that we have to work with and would start using them and inquire about them. That's the end of part 1, back pain, the problem.